Hello, my name is Marc, and I'm the Genitourinary nurse consultant here in MacCallum Cancer Center. I am also the co-chair of the Victorian Urological Nurses Society's Bladder Cancer Group. May is Bladder Cancer Awareness Month, and this is a good time to be reminded that the early signs of bladder cancer is often disregarded, forgotten, or misdiagnosed. What exactly is bladder cancer, you might ask? And it is any abnormal growth in the bladder. It usually starts off in the innermost lining of the bladder. It then rapidly multiplies and grows. And this growth has the potential to go deeper into the other layers of the bladder and also potentially spread to other parts of the body. Bladder cancer is the 10th most common cancer in Australia, and it is actually one of the most expensive ones as well to manage, because it will require repeated hospital admissions and ongoing management and monitoring throughout a person's life. It mostly affects people over the age of 60, and men are 3 times more likely to get this cancer when compared to women. That said, women are often diagnosed at a much later stage of this disease, which can also affect the overall outcome and experience. Apart from gender and age, additional risk factors can also increase your likelihood of developing bladder cancer. These will include smoking, chemical exposure at work, chronic urinary tract infections or UTIs, long-term catheter use, and other cancer treatments. It is not fully understood if bladder cancer is genetic, but a family history is still considered a risk factor. Most people passing urine consider it as something that's automatic and you don't really think about it very much, let alone have a look at it. But the process of actually going to the toilet is a very complex one. The bladder is quite a smart organ, and it is designed to simply receive urine from the kidneys and to hold this urine until you're actually comfortably full and ready to go to the toilet at a convenient time and place. The experience of passing urine and the quality of the urine that you pass can actually give you a lot of information. Like most cancers, bladder cancer outcomes tend to be better if the disease is caught and managed early. In some cases, bladder cancer may be found incidentally, when a person has a urine test or a scan for a completely different problem. However, most people that are diagnosed with bladder cancer do notice changes in their urine or their voiding habits. And as the saying goes for Bladder Cancer Awareness Month, that's if you see any changes in your pee, you should see a GP. These changes may include the presence of blood in the urine or an increased urgency, frequency, or discomfort when going to the toilet. Of course, not everyone with these signs and symptoms have bladder cancer, but it is important to properly diagnose and assess the cause of these changes. The treatment of bladder cancer depends on how far the cancer has grown into the different layers of the bladder and whether there are any signs of bladder cancer elsewhere in the body. We may use surveillance, surgery, immunotherapy, chemotherapy, or radiotherapy to treat and manage the bladder cancer. Despite efforts though, the 5-year overall survival of people with bladder cancer has actually decreased in the past decade. But new treatments are underway, and hopefully we can change this trend. So it is really opportune time for all of us, to increase the awareness of this disease, because early detection will make a huge difference. So during the Bladder Cancer Awareness Month, please do tell your family, friends, or even co-workers that if they see any changes in their pee, do not take it for granted and make sure that they do see a GP. Thank you.